Hey, everybody. I'm so excited to be talking to you today. I always get excited because I get to talk about whatever it is that I think might be helpful to you for you to grow your practice, to build your dream practice, or to live your dream life. Any of those things. And oh, I can see my background. I usually fuzz it out over here. Those are all some of the books on my list of things to read. Excuse my mess, ladies. So today we're going to talk about practice growth and a strategy that is often overlooked by people when we actually talk about practice growth. So if you want to grow your practice in size, as in more active patients in the practice, or just in profit, so more money per patient, then what you need is a very robust follow-up system, which is what we're going to talk about today. You might be asking why? Why is this a topic worth discussing? Well, as you know, there are many factors that come into play when we talk about practice growth. And one that I speak about all the time is the retention of the patients that you attract to the practice. So that includes things like how you handle phone calls, how you do case presentations, the financial options you offer to your patients, the external marketing that you do, the customer service you provide, the energy of the office, the language you use. I mean, there's a million things. And we're going to talk about follow-up today because it is often one that is skimmed over or completely overlooked. So I want you to take a serious look at your current follow-up system. What do you currently do for patients once they've left the office? Now, I know that I tell you guys all the time to audit what you're currently doing, and I know it's annoying that I'm giving you homework all of the time, but there is truth in this. There's a reason for that. If you can't see clearly what you're doing right now, then it is absolutely impossible to design something that will work better, right? So if you want to get somewhere different than where you're currently getting, you need to set goals. You need to have a change, something in your systems, your processes, something has to change. It is impossible to know what to change or how to change it if you don't know where you are right now. So here's some questions to think about when you're thinking about follow-up in your office right now. So when a patient comes in, and they don't book some of, or maybe all of, the treatment that you recommend when they come into the office, and there can be many reasons for that, what do you do for follow-up? Do you call them? Do you text them? Do you email them? Do you do some combination of all of those things? When you do reach out, for how often do you reach out? So what's the frequency of those? And for how long? Like, do you reach out for 1 month, 2 months, 6 months, 12 months? Like, for how long afterwards, right? Make sure you're making notes on all of this stuff. Is there anything that you're doing to let them know that you care besides this regular phone call, email, text, or whatever it is that you're doing? And I want you to also consider what they leave the office with from you. So do they have all of the details that they need to explain their treatment or what they're going to get from your office to someone else in the family, should that be maybe the hiccup of why they didn't book future treatment? So do they have enough information that's leaving them when they leave your office that they could explain or show to someone else exactly what it is you recommended and why, so that they have some evidence, especially if they have someone resistant at home, to back up this decision? Do you have a long-term nurture email sequence in your office? I've talked a little bit about email marketing. Do you have something where you can just, plug in their email address, because you would have collected that if they came to see you, and they can receive messaging from you over the long term that's automated, right? That you don't have to do anything about. Do you have that in place? Do you think that patients who leave your practice are super duper confident with how to contact you, with how to get back in touch with you? Has that been explicitly explained to them? Did you tell them that you're going to be reaching out in the future? So it's not a surprise, so they don't feel like you are hassling them. Do they know that you're going to reach out to check in on them because you care and you want them to get this service that you've recommended or treatment? Do they know that you're going to be reaching out to them? It's important that people know what's coming. And then after you've done this audit of your current systems and processes, I want you to think about what you actually want this to look like. In your mind, what looks like excellent, caring customer service on that back end? What does that look like to you? I will tell you the things that I think are good practices, but I'm not you, and you get to do whatever you want in your practice. Yay. So you get to define what excellent, caring customer service looks like on that back end. There's a few big mistakes that I see all of the time. One is not following up often enough, and the other is not following up for long enough. One follow-up call, one text, one email, not enough. Not even close. You should be following up with people until they ask you to stop. I'm not joking. Life is busy. Things happen. And people often want to do something or want to eventually make a decision about something, but you need to catch them at the right time. And if you've already forewarned them that you're going to follow up with them, and let's say they decide firmly that they are not coming for treatment at your office, then they will tell you that when you keep reaching out to them. They will say, please stop contacting me, or I'm not coming back, or can you please not call anymore, or whatever. They'll ask you nicely. Most people will be very kind about this and then stop contacting them. But until you get a please stop from them, you're going to keep contacting them. You need to do this in a way that is kind and caring and not annoying. I don't want you to be pushy, but you don't stop until they tell you to stop. I personally think that some form of in-person contact, which means reaching out by text or phone, should be attempted over at least a 6-month period. And it should be more frequent touch points the closer to the last time they saw you were, and then it gets less frequent. So you might contact them, 1 week after, and then 3 weeks after, and then 6 weeks after, and then 2 months later, and then 3 months later, right? So you can stretch that out. And what I really think you need to have in place is after the 6-month mark, after you've reached 6 months of reaching out in person, letting them know you care and that you're there for them and you're there to answer questions and help them through treatment and get them booked and all of those good things, every single person that did not book back for all of their treatment should be added to your long-term nurture email campaign. So that they should be receiving anywhere from weekly to monthly to quarterly, whatever you do in your office, whatever works best for you, messaging that provides value to them. You want them to not forget about you. You want them to be reminded about how much they liked you and why. And you want to be able to keep them up to date on new things happening in the office. Maybe you have a new bonus. Maybe you've just done new training and there's something brand new you're offering. You want to be able to let these people know. This also includes if you have a monthly newsletter. If you're currently sending out an email newsletter, then these people should be added to that newsletter list. All of these have an unsubscribe button on them. So if they decide they don't want information from you, they can just unsubscribe, right? My point is this. You really, really want your patients to know and understand that you care about them long after they've left the practice. That it's not just you care about them in the moment that you're asking them for their money. And you're going to continue to let them know you care and follow up with them and try to stay top of mind until they ask you to stop. After all, the treatment that you recommended is in their best interest. So helping them to get that treatment means you care about them and you care about their oral health. You owe that much to your patients. And if you do this consistently, you will have more patients do more treatment in your office. It's a fantastic way to grow your bottom line if that's what you're looking to do. You'll do more dentistry per patient. You'll also retain more of them in the practice over the long term because they're genuinely going to know how much you care about them. So take a look at what you're doing. And if you can improve it somewhere, do it. It's worth the investment. I'll see you guys next week. Bye-bye.